welcome to day 2 of CBD Live Europe, our online conference about all things CBD and medical cannabis. I hope you're enjoying the event so far today. Today's agenda is all about advancing the case for medical cannabis in places like the UK and right across Europe. I am Roisin Delaney. I'm the editor of the Cannabis magazine, an essential guide to CBD and medical cannabis, and the publication behind this event. And I'm delighted to be joined today by Charlotte Caldwell and Billy Caldwell, familiar faces to many in the community, as well as Dr. Matt Brown, who's an experienced pain consultant from a leading London cancer centre. So thank you both for taking the time to join us here this afternoon. If anyone would like to submit some questions for either Dr. Matt or Charlotte and Billy, let us know. You can just pop a question in the Q&A box that you see in the panel on your screens. But before we get into questions from our viewers, I suppose it's important to kind of just recap on everything that's happened in Billy's life, Charlotte. And last autumn was a crucial time when Billy finally got that crucial prescription from the NHS, his third prescription for medical cannabis on the NHS. And he recently marked a really big milestone of being 1 year seizure free. So tell us a little bit about, what life has been like for Billy over the past year.
Yeah, hi, Roisin. Thank you for having us folks. You're going to say hi. Billy will wave, Roisin, just simply because Billy's non-verbal. But anyway, so yeah, Roisin, thank you so much for having us. The last year has been a momentous milestone for Billy. His seizures are controlled. So many things they said he wouldn't do, so many years they said he wouldn't see. And here he is today. He's happy, he's laughing, he's loving life. He is growing up into being quite the young gent. Billy is not just surviving; he's thriving, and he just keeps making it. Really proud of him, really proud of him, and that's obviously thanks to medical cannabis, to his medicine.
Oh, fantastic! And Charlotte, Billy's case really has, opened up kind of people's minds to medical cannabis as well. So do you think that he's kind of helped, other patients as like a knock-on effect from his own case?
Yeah, I think you do. I think when Billy's medicine was confiscated in 2018 at London Heathrow Airport, that actually opened the door to the private medical cannabis clinics. And also it opened the door to the cannabis medicine market in the UK.
Fantastic. And it just goes to show, all the things that have happened in the last few years around medical cannabis in particular. There's been great progress, happening across the board. So long may that continue. So, as you campaign, you've campaigned for medical cannabis for years now, Charlotte, long before anyone else was talking about it, let's say. But also being a mum to Billy, who relies on this medicine, what has kind of kept you going through the process, especially coming up to kind of last autumn when it was really kind of, a lot of pressure on any parent to go through that?
Yeah. I think the one thing that really for me is was the fear. When you lay awake for years until the sun comes up, scared that if you go to sleep, you'll wake up and find your child cold and blue beside you. That's what keeps you going. And we find cannabis as a medicine. That is why I fought so hard. That's why I wouldn't give up. It is quite simply that. Like to get a child like Billy to a place where he only seizes when he has an underlying health condition that needs fixed. Otherwise, he's completely healthy. A completely healthy child, that really should say it all.
Absolutely. And just touching on that as well, his quality of life must have really improved, now that he's a year without seizures. Thinking back to the amount of seizures that he would have had without medical cannabis, I suppose, what's his quality of life like now? How much better is it like? What would his life be without medical cannabis, if you think about that perspective?
To be absolutely and totally honest, if Billy hadn't got legal safe access to cannabis medicine, he would either be seizing all day, completely depleted in a wheelchair, or he wouldn't be here.
Wow, that's stark to think of the comparisons, and I suppose all the more to celebrate these milestones, like, you know, being seizure free. You shared a lovely photo the other day of a almost like a birthday party that you had to celebrate that magnificent milestone. So what an accomplishment. So what's, you know, the future have? What does the future have in store now for Billy and yourself?
Well, first of all, Roisin, I just want to be completely clear about Billy and his medical cannabis and his condition. Billy is not by any way, any means cured, albeit that he is 1 year seizure free. You know, Billy will always have epilepsy, but in the blink of an eye, that could change. So I just wanted to get that point across. But the last 6 months, we have been working extremely hard with some of the most amazing friends that Billy has made on this 5-year journey of his to access medical cannabis. And we will be launching a major national campaign shortly, never been done before in the UK. This campaign will be focused on addressing the urgent needs of the most vulnerable, chronically ill patients in our society. So anybody watching this today, watch this space, because Billy and I'll be out on the campaign trail shortly.
So the story's not over yet. There's still a lot to come, I'm sure.
Yes.
So at this point, I'd like to invite Dr. Matt Brown into the conversation, because, you know, obviously with Billy's, I suppose in the case of Billy Caldwell, we're looking at severe epilepsies, but you're on another kind of side of the medical cannabis discipline, I suppose we could say, in cancer patients. So tell us a little bit about your kind of expertise, if you wouldn't mind to start off, please.
Yeah, thank you very much for asking me to come along and speak today in a personal capacity. I think actually when you look at long-term conditions, so things like epilepsy, things like persistent pain, there's a huge amount of commonality between conditions, not only in the role that medical cannabis could potentially play in enabling patients to manage their condition and, as you said, improve their quality of life, but also in the sorts of unmet need that we see in patients with long-term conditions. So I know from talking to Charlotte that she gets contacted an awful lot by patients asking for advice on how to manage their epilepsy or the epilepsy that loved ones may be experiencing. So there's often a real lack of good quality information that patients can access. Patients often are also unaware of potential treatment pathways that they could be accessing. And what we know, certainly in the UK, for example, in cancer pain, is that there's a huge variation in service across the country. There is genuinely a bit of a postcode lottery as far as accessing treatments are concerned. So I think there is a degree of commonality between, for example, pain and cancer survivors, which is my real area of interest, and the experiences that Charlotte and Billy have had. And I think it's really interesting to think about the ramifications that poorly managed long-term conditions have, both on the patient, but also on the carers who are often, contributing to the management of patients, and also to society at large, who, there are burdens placed on society when patients present to hospital, for example, with flare-ups of their condition. So it's a really, really big area that needs to be addressed.
And I suppose, one kind of question that we get a lot, which is great to have someone like yourself, a doctor embracing medical cannabis on this kind of platform to address, is the question of, why is it so effective in certain cases, in particular with pain associated with cancer cases? What is it about medical cannabis that works?
I think that's a great question. I think it's important to think about medicinal cannabis as a tool in a toolkit to manage a long-term condition. So if you take pain, for example, we always try and manage long-term pain through what we call a biopsychosocial model. So you don't just try and address the sort of the cellular reason for the pain using a drug, but you also, put in some physiotherapy, you work on psychological rehabilitation as well. Why are cannabis-based products potentially helpful? Well, there's evidence that they can reduce the reliance on other analgesic agents, which can have unpleasant side effects, so things like opioids or anti-nerve pain drugs. There's evidence that they can have beneficial effects on psychological morbidity, so things like anxiety or insomnia that often worsen a long-term condition. And I think that what responsible practitioners should be doing is looking to integrate medical cannabis into a management plan, a shared decision plan with a patient to work on their rehabilitation. I'm sure, for example, Billy now is able to do a lot more physiotherapy and things like that, and a lot more rehabilitation work, which leads to a global and more holistic improvement in a patient. So yes, medical cannabis is important, but it's also important as to how you integrate it into a bigger clinical plan for the patient. And that should be a shared decision, basically.
And that's something that's really kind of crucial to, I suppose, once you've kind of looked at medical cannabis as a therapeutic option to the other aspects of life, not just that condition that the person is suffering from, but maybe something as a knock-on effect, maybe that person can go back to work as a result of being on a medical cannabis prescription. So that's really kind of fundamental, looking at the broad kind of quality of life benefits that someone might be able to have from this. So if someone is kind of curious about how to go about getting a prescription, obviously Billy is one of very few people to have successfully got a prescription from the NHS, and with time and with research and data, we're hoping that this is going to be the norm. But while we kind of wait for that to catch up, how do you go about, talking to a doctor about medical cannabis? What would a patient say to you, for example, if they're curious about it? And what's the kind of structure to actually leave it with a prescription?
Yeah, so lots of important points there. Point number one is these are unlicensed medications, right? So there are very clear and strict guidelines about how doctors should be prescribing these medications. In the UK at the moment, you have to be on the specialist register, the GMC, or in a sort of shared care arrangement with a specialist overseeing the prescriptions to write the prescriptions. There's a number of different requirements that need to be met before the medication can be prescribed. I think as a patient, you should be looking to have a full and frank conversation with your clinician about your treatment plan. And I think, unfortunately, at the moment, I'm in a sort of post or peri-COVID world, accessing clinical support and advice is very difficult. I think that the NHS, as everyone is aware, is under and has been under a huge amount of pressure. And the work that the NHS is going to have to get through in the next couple of years is eye-watering. I think that it's going to be very difficult for patients to have these discussions, unfortunately. And to be honest, I don't know what the solution to that is at the moment. I think that what that doesn't address is the fact that there is a huge unmet need in the community. We know that patients are either illicitly acquiring cannabis to self-medicate, or are having to self-fund cannabis prescriptions. And we know that a lot of patients with long-term conditions, it's lower socioeconomic classes, it's parts of the country that there's a lot of deprivation. And these are patients who are often unable to access safe and reliable sources of medicinal cannabis. So it's a huge issue. do I have an answer to that, to that issue? No, not really. I mean, I'd hope that my patients would be able to speak to me about using medicinal cannabis, and I know they certainly do in my clinics, and I know from my colleagues that that's the same. But do I see a rapid change in the way that that's going to the NHS is going to respond to that? Unfortunately, not.
I want to ask you a question specific to chronic pain, if I can, because I've spoken in recent weeks to a number of doctors who specialize in this area, and the answer has been kind of pretty much right across the board the same. You know, do you see in your line of work, do you see a time when medical cannabis can be used as a viable long-term like therapy that people can take, you know, to literally improve their quality of life for the years that they have left to live?
So the International Association for the Study of Pain their task force has just published guidance on the use of medicinal cannabis in pain, and the Faculty of Pain Medicine, which is the UK kind of professional body for pain clinicians, have both said that the evidence base at the moment for using medicinal cannabis in pain is not robust, but that further work should be done. The IASP statement specifically says this doesn't close the door on the use of medicinal cannabis in pain. What it simply does is flag up the fact that the evidence base at the moment isn't robust. That raises a load of really important questions. It may be that the studies that have been conducted before just haven't looked to the right things. If you look at a simple unidimensional pain score, 0 to 10, that isn't the same as looking at functional levels, looking at quality of life, looking at employment status, looking at reductions in opioid intake. So there are very, very different things that patients might be getting from using a prescription of medicinal cannabis than what studies have been designed to do. So I think that what we need to see in the UK is a mature response to that, and that is, in essence, conducting high quality clinical research to demonstrate benefit if it is present. So to me, the IASP task force was, you know, raises a load of very valid questions, and I think that as a specialty, if you want to term medicinal cannabis that in the UK, I think that we should be rising to that challenge and relishing the opportunity to actually get involved with proper clinical research.
And I suppose that involves some sort of level of training that doctors will have to kind of undergo as well, doesn't it? Because, you know, you've got the endocannabinoid system to look at, and we're always hearing from, you know, very qualified specialists such as yourself who, you know, say, well, this isn't something that they teach at medical school.
Yeah, but they teach us about how to run a clinical trial, and it's you know, running clinical trials is something that many clinical academics do across the UK. Most big academic hospitals have a huge clinical trials unit. There are vast numbers of very well qualified people who can, you know, lead and run and undertake clinical studies. There has to be engagement from industry with this. It is a responsibility of everybody involved in this to get these trials done, to get studies done, to benefit our patients and to benefit you know, people like Billy, who we don't want to have a situation in 10-15 years time where other parents are lying awake at night worrying about their children. You know, I'm a parent as well. I know what that would feel like. And I think that, yes, there are hurdles to leap, but I think that with collaboration and a mature conversation, we can leap those hurdles.
Right. And I think, we just need to hopefully be patient and you know, let the data, I suppose, catch up with the interest, I suppose, is the thing, isn't it?
Yeah, but I mean, the sad thing, I guess, is that doing high quality research, it takes time. You have to design the studies, you have to get the regulatory approvals, you have to build the team, build the collaborations, recruit the patients. It takes time. But I can, you know, reassure people that behind the scenes, those cogs are turning, and there will be changes, there will be studies that people can get recruited onto, and that's really exciting.
Yes, I heard from another doctor earlier on a panel I was hosting. It was Dr. Daniel Couch, who is the medical lead at the Centre for Medicinal Cannabis. And he was talking about, you know, how the NHS and NICE, that they want to help people. They want to present new therapeutic options to doctors and patients. That's their job. They want to be there to help people. They don't want to, you know, get in the way. But there is a certain responsibility there as well to you know, develop the drug, so to speak, to make sure you get it right. Yeah,
and you know, if you're a patient, that is really reassuring, isn't it? That actually, the regulatory bodies, they are there to safeguard patient safety and well-being, and to make sure that research is done to a high enough quality that it actually delivers what it needs to deliver. And that to me, you know, as a patient in the UK as well, that's what I'd want to know. And you know, what Dan says is right, that, you know, NICE and NIHR and all the other governmental bodies, they're not there to obstruct things. They're there to assist and to advise and to guide people. And certainly in my interactions with all of those bodies, there's always been a real engagement and an enthusiasm for this. But, you know, the bottom line is you have to do it the right way. You know, it's like before a plane takes off the ground, the pilot walks around and checks everything. You know, it might add 5 minutes onto your journey, but I'd want my pilot to be checking the plane that I'm flying in. And it's the same with these kind of studies. It has to be done the right way.
So we've got a couple of questions that have come in, and we do have 5 to 10 minutes to take some questions for Charlotte and Dr. Matt. So if anyone would like to get a question in, now is the time. More of a thank you here aimed at you, Charlotte, from Xavier, who says, as someone who has had so much benefit from medical cannabis, I want to thank you for all of your help and drive and all of the truly amazing work that you have done. So big thank you there from Xavier for Charlotte and Billy.
Thank you.
We've got a question here relating to, I think, something that you answered on, Dr. Matt. With medical cannabis, do you think that we can move away from opioid-based medications? Having woken up in the night with agony and spasms, I was worried about accidental overdosing and the delay in taking the medications. I think that's onset times there. So do you have an answer for that? Is that something that you can answer for us?
Yeah, I mean, when you're planning medication with a patient for chronic pain, generally you're looking at something called a multimodal approach. So you're looking at taking, you know, 1 or 2 or 3 drugs to, well, no, one, will it? But it's 2 or 3 or 4 drugs working together synergistically, so they complement each other. You can get away with lower doses, less side effects. And to be honest, the whole point actually of chronic pain medicine is it's a rehabilitative specialty. You're trying to get people off medications. You're trying to facilitate physical rehab, psychological work, and can medical cannabis play a role in that? Yes, when it's integrated into a proper management plan. And that's what people should be working towards. It's not a silver bullet that's going to take everything else away and make it better, but will it facilitate doing all of the things that you need to do to rehab and improve your functional levels? Yes, it may well do so.
So we've got another question here, and I'm not sure which one of our panelists would be best placed to answer, but nevertheless, here we go. It's from Neil. Lots of people, including me, says Neil, can't understand why other countries such as Canada, the US and Australia have made cannabis legal for a wide number of treatments. But in the UK, we still insist that we need more lengthy trials to create more data. Why is this?
Yep. So
I suppose that might be asking, as kind of a side note, that might be asking, do we need UK specific data?
Charlotte, do you want to say anything?
Well, I think this one should be answered by the doctor.
Right, fair enough.
I'm not a clinician, nor am I a regulator, and I won't portray it myself to be. So, yeah.
No, fine. So, well, the bottom line is that medicinal cannabis is legal in the UK. It's the licensing of the medicine that is the issue. And in order to get marketing approval and licensing, certain thresholds of evidence have to be produced, and that process hasn't been engaged with by companies that produce medicinal cannabis. They haven't gone for marketing authorization. So that's one facet of that question. The other thing, I guess, relates to things like NICE guidance. And if you look at the way that NICE synthesize their evidence base, they're incredibly strict on the quality of the evidence that they take. So that's slightly different from some of the regulatory bodies in other countries. So what NICE do is a sort of cost-benefit analysis, and medicinal cannabis doesn't do particularly well on that compared to other treatments. So why do we need better quality studies? In essence, it's to produce evidence that meets the NICE requirements, so that when they sort of reboot their assessment next time round, they may well take that evidence on board. I think your point, Rosen, about a UK-centric data is really important as well. And we know that, for example, chronic pain, that's influenced by the society and the world that you live in. And taking data sets from other countries, they often don't transplant particularly well to the UK, where we've got a very sort of unique type of healthcare kind of ecosystem. So again, having UK-centric data is really powerful.
We've got a question here for Charlotte and Billy. I think we mentioned this briefly at the start, but perhaps this person missed the beginning. Charlotte, how long did it take to get Billy's medical cannabis prescription? It was a long journey, but Billy's now on his third prescription from the NHS. But this attendee is asking, how long did it take to get the prescription?
Yeah, so just like you've stated, Roisin, so Billy is now on his third NHS funding for medical cannabis. So if the question is, how long did it take one prescription, or how long did it take the three NHS funding to be released for Billy? So it's nearly 5 years it's taken us to secure Billy on long-term funding for his medical cannabis via the NHS. I should maybe expand a little bit on that to let this person know. Billy got the first medical cannabis prescription on the NHS for whole plant medical cannabis in April 2017 was the first one he received. That one was withdrawn in May 2018. Then June 2018, he got his prescription reinstated, and that one was also withdrawn in November 2018 after the law change, which took place on the 1st of November 2018. So then we had to go a further 2.5 years to actually get the third NHS funding reinstated, which was October 2020.
It's just remarkable to see the difference that it's made to Billy's life, and the potential that it could hopefully, hold for other people, and Billy is such an inspiration to so many, I'm sure, who are out there.
I think as well, Roisin, just on that note, if I can say to that person, that is why we are launching our new national campaign. That is simply why, because there is no patient in the UK, especially we all have to remember these are vulnerable, chronically ill patients. There is none of those patients should have to go through the torturous ordeal that Billy and I went through. So that's why we are going to be champion patients in the UK, the urgent need of patients with our new campaign.
Yeah, and that's really, really, really critical, I think, to voice. A question here for Dr. Matt, if you don't mind. Why do you think it takes so long for a patient to push so hard for a medicine in order to change the laws? I suppose that's in reference to the time frame that Charlotte was mentioning there. Is it the stigma behind cannabis or anything else?
Yeah, I think that's a really interesting question, because if you dial back, 120 years, cannabis-based medicinal products are very, very widely used globally for, really broad range of indications. And, the history of medicinal cannabis is interlinked with the history of the development of medicine. And it only became stigmatized much later in 50s, 60s, 70s. And I often joke that if it was, if it had a sort of investigatory drug name like Z5-22716, it would be taken far more seriously when you go to, ethics committees and things like that, because there is always a slight kind of tittering behind the hand when the medical cannabis study gets looked at. So is there a degree of stigmatism? Quite possibly. Is there an endocannabinoid system, which is one of the biologically oldest physiological regulatory systems known in organisms? Most definitely. And I think that the time lag that we've seen isn't just the stigma, it's just the natural inertia of regulatory systems coming to work. I always say, I can build an extension on my house, no problems at all. But in order to do that, I have to get planning permission, building regs, Party Wall Act. It adds months and months and months to the process, but that's what you have to do. And it's the same with these kind of processes. There's just a lot of regulatory hurdles, which I can understand people's frustration. But as I said, behind the scenes, these things have been going on to get high quality studies up and running, and are going on.
And as you said earlier as well, Dr. Matt, you said, you are aware, just as other doctors that we've spoken to at this conference have said, people are starting to talk about medical cannabis in the healthcare sector now. And it's not this kind of dirty subject anymore that people are, afraid to talk about. And that's fantastic. That's progress. I think we're nearly ready to wrap it up. But Charlotte, I'll give you the final word if there's anything that you would like to say, Charlotte and Billy, to finish us up on this Thursday afternoon. Is there anything you would like to tell our viewers this afternoon?
Yeah, just keep going and don't give up.
And how can people get in touch with yourself, Charlotte? Is it through the Facebook page?
Yeah, and we're also on Twitter and on Instagram as well. So yeah, obviously if anybody wants to get in touch, please do. And as I said before, watch this space. Our major national campaign is coming shortly.
Very good. We can't wait to see what comes from that. And Dr. Matt, how can people get in touch with you if they're interested in particularly your work as a pain specialist where cancer is concerned, if they have questions there?
Thank you. So it's Instagram, survivor_doc. So as I said earlier, cancer survivorship is my main area of interest. And yeah, thank you very much for inviting me along today.
Absolutely, it's been a pleasure. And for anyone who is staying online to see what's coming up next at the event, we have a really great panel about how we can further access to medical cannabis at a distribution and manufacturing level across the continent from Germany to the UK. That's coming up at 4 p.m. UK time. Thank you so much to everyone for taking part in this panel, and it was absolutely great to see you all, and we hope to see everybody in person in the very near future. And thank you again for joining.
Thank you, Roisin.
Yeah,
Thank you.
Thank you.
Bye.
Thank you. Bye. Bye. Bye.